Hemostasis sounds complicated because we often jump straight into pathways and factor numbers, but at its core, hemostasis is a very logical, stepwise process. In this video, we look at the big picture. What happens when a blood vessel is injured? Here, we'll define what is hemostasis, look at the sequence of events, understand the role of platelets, coagulation factors, and endothelial cells without getting lost in the details. I'm Nabeel, this is Pathocyte. What is hemostasis? Hemostasis is a process by which blood clot is formed at the site of vascular injury to prevent hemorrhage. It is essential for life. Too little can cause bleeding, too much can cause thrombosis. Although we often separate thrombotic disorders and bleeding diseases, the boundary is often blurred, like in cases of disseminated intravascular coagulation. Hemostasis is a precisely orchestrated process involving three main players: platelets, coagulation factors, and endothelium. These three work together at the site of vascular injury to form a clot. But just as importantly, they coordinate to restrict the clot only to the site of injury. Now let us look at the sequence of normal hemostasis. When a blood vessel is injured, the first response is vasoconstriction. Arterioles constrict, reducing the blood flow to the area of injury. This response is mediated through reflex neurogenic mechanisms and also by the release of substances like endothelin by the endothelium. However, this effect is transient. Vasoconstriction alone cannot stop bleeding. The next step is primary hemostasis, formation of a platelet plug. Endothelial injury exposes subendothelial collagen and von Willebrand factor. Platelets adhere, become activated, and change shape from a smooth disc into a spiky sphere like a sea urchin, and then release granules that recruit additional platelets. Within minutes, platelets aggregate to form a temporary hemostatic plug. This platelet plug is important but not stable. To stabilize this platelet plug, secondary hemostasis occurs. Vascular injury exposes tissue factor, which initiates the coagulation cascade. This leads to thrombin formation. Thrombin converts fibrinogen into insoluble fibrin. This fibrin forms a mesh that cements the platelet plug in place. Step 4 is clot stabilization and resolution. Here, the clot undergoes contraction, becoming a firm, stable clot. At the same time, counter regulatory mechanisms are activated to limit clotting to the site of injury. Eventually, the clot is removed and normal blood flow is restored. At this point, it is important to recognize the central role of endothelium. Endothelium is not just a passive lining, it actively regulates hemostasis. Normal endothelium is antithrombotic. It inhibits platelet aggregation, inhibits coagulation, and promotes fibrinolysis. When endothelium is injured or activated, the balance shifts and it becomes prothrombotic. This switch determines whether a clot forms, propagates, or dissolves. So, in normal hemostasis, first vasoconstriction, then platelet plug, then fibrin formation, followed by clot stabilization and a controlled resolution of the clot, all under the regulation of endothelium. Understanding normal hemostasis is essential before we go into thrombotic disorders, bleeding diseases, and other conditions like DIC. In the next video, we'll look more closely at the individual players, platelets, coagulation factors, and endothelium from a functional perspective. Think at the cell level.